If you have rheumatoid arthritis and you're getting sharp pain in your butt or it's radiating down your leg, it could be sciatica. But it could also be RA mimicking sciatica. And the treatments are completely different. I'm Dr. Neha, rheumatologist. Let's break this down. To make it simple, sciatica is when the sciatic nerve is being pinched or irritated, and that nerve runs from your lower back to your butt down the back of your leg. The true sciatica pain is usually a sharp electric shooting type of pain. It could be tingling numbness and pain that's going past the knee, usually one-sided, and it's worse with sitting, bending, or lifting something. This comes from the spine and it's usually not rheumatoid arthritis. But here's where it gets confusing. People with RA can absolutely have real sciatica, and RA can also cause pain that feels exactly like sciatica, even though the nerve isn't actually involved. This surprises people, but sciatica is actually very common in people who have rheumatoid arthritis. Not because RA is directly damaging the spine, but because a lot of RA patients are in their 40s, 50s, 60s, 70s, or above. And at that age, it is extremely common to have disc bulges, spinal stenosis, foraminal narrowing in the spine, or just plain old arthritis in the spine. These are kind of the classic causes of true sciatica. So yes, RA patients frequently get the real stuff, simply because of age-related spine changes. But where does RA kind of play into this? Here's the twist. Sometimes what looks like sciatica is actually RA inflammation in the hip joint or in the sacroiliac joint, the SI joint. And treating it like sciatica doesn't really help. So the most common RA-related causes are usually hip joint inflammation. And when the hips are inflamed, it can send pain to the outer hip or the groin area. Often it's described as a deep and achy pain. It's not really an electric pain, and it doesn't usually go below the knee. What about sacroiliac or SI joint irritation? This joint kind of sits at the base of your spine, otherwise we call it the butt joint. And when it's inflamed, it can cause buttock pain that people swear is their sciatica. And oftentimes that's where it starts, right? Your sciatica. So it's really hard to kind of differentiate. But again, it doesn't shoot past the knee. What about the tendons in the buttock? Because RA can inflame those, right? RA is not just in the joints, it can be in your tendons, ligaments, cartilage as well. And if you have it there in the gluteal region or the butt region, that pain can be worse when you're sitting, and it can feel like it's a nerve, but the nerve is actually fine. But here's something I see in clinic all the time. When you have pain from RA, you're having a weak core and weak glutes, more pressure on the spine, and this can be true sciatica. It's incredibly common. Your core muscles, they're supposed to act like kind of a corset that protects your spine. But after multiple RA flares, or if you're sedentary for a long time, just sitting still and not working out, those muscles can really weaken. And when you have a weak core, you're gonna have more spinal compression, less support, and more nerve irritation. So a lot of times, for example, women in their 50s, 60s, they often develop sciatica after an RA flare or periods of inactivity, right? They weren't doing anything, they've kind of gotten weak in that area, and then their sciatica acts up. And don't forget that RA often changes your posture, right? Because if something hurts, like your hips are hurting or your knees are hurting, which are places that you can have RA, you may be walking a little bit differently. Even if it's a degree or two off, that can also trigger the nerve pain because you naturally start leaning forward, maybe shifting a little bit more to one side, tightening your lower back, shortening your hip flexors, rotating your pelvis. And these posture changes increase pressure on the nerve roots of the lumbar spine. For example, let's imagine your left knee hurts. So you shift your weight to the right side. Now your pelvis is tilting a little bit, and that side sciatica nerve gets irritated. It's like a domino effect. So you need to figure out how to break this cycle. And aside from medications, this is an area where physical therapy can really help you out. So the big question is, how do you know if your leg pain is from RA or from sciatica? We can look at this checklist. This is more likely to be true sciatica. This is more likely to be your RA. But of course, your body doesn't always read the textbook. So sometimes there is a little bit of overlap and it's really hard to kind of tell the difference. But this is kind of a good rule of thumb. If your rheumatologist isn't sure, it's sometimes helpful to see a physiatrist or a pain management doctor to see if it's different muscle groups that are contributing to that sciatica pain. Can you do if it's real sciatica? Go to PT and focus on the core and the glutes, the gluteal region. You want to walk more, sit less. You can use ice for when there's sharp nerve pain, right? We can use ice or heat in general, but oftentimes people prefer in sciatica that ice might be a little more helpful. Heating pads are also okay, don't worry. You can use short-term NSAIDs or anti-inflammatory medications if your doctor lets you and there's no other contraindications, and rarely injections or surgery. Actually, I won't say it's so rare. Plenty of my patients do get injections like epidural injections, kind of on the outside, and surgery. And I had a really interesting point brought up. The other day, my patient was like, why can't I just take steroid dose packs, those Medrol dose packs, whenever I have a flare of my sciatica? And it's a good question, right? Because it really seems to help some people. But there are so many long-term potential side effects when you take repeated courses of steroids and it becomes more of a chronic thing that sometimes we prefer localized injections, even if it's a steroid injection, kind of local to the area. So hopefully it's not affecting the entire body. And what if it's your RA? Well, then you really have to deal with the medications and see where it can be improved. Anti-inflammatory lifestyle habits, if you've got all your medications that are covered and they're really helping your joints, and I've had different videos on that before on food and nutrition with RA. Do gentle hip and SI mobility exercises. And oftentimes people with an RA flare feel that heat can work better than ice. Again, it's just a rule of thumb, maybe different for you. So if you try to treat RA pain like sciatica, it may not work. And if you try to treat the sciatica pain like RA, it may not work. What are some red flags though, right? So a lot of people get back pain, it can go down their leg, and maybe that's just you and it happens once in a while. But what are some really concerning things? If this happens, you need to get seen immediately. So see a doctor soon if you have any spreading numbness, any new weakness in your foot or your leg, especially if you have trouble lifting your toes. Like if you're having to lift your entire foot to take the next step because you can't lift your toes, then that's called a foot drop. That's actually very alarming. A lot of these things we can take care of if we get to it quick enough, and they can be reversed sometimes. But if you let this go on for a long time, there's very little chance, or there's much less chance of reversing it. So get seen immediately if these things happen, or if your pain keeps worsening, or even if you have a change in your bowel and bladder habit. If you pee on yourself and you couldn't control it, or poop, that's very alarming. It's not just embarrassing, that's actually alarming, and you need to be seen right away because that sciatica could really be affecting something. Your spinal canal could be closing things off too severely. And when should you call your rheumatologist? Well, if your pain is getting better when you take your RA meds, but it keeps coming back, right? That makes sense that it could be the RA when you take your medications for it and your pain, like for example, if you take your biologic, your injectable biologic, you're giving it yourself and your pain goes away, right? But then as it's time again for that biologic, the pain comes back in your back, that could be related to RA then, especially if you have a deep morning achy stiffness, or if your pain is really not going past the knee and it's kind of staying around the hip. Like I said, it flares up and it lines with your other joints. When your hip is hurting, or when you're getting that sciatica pain, but you're also having wrist pain at the same time or knuckle pain at the same time, then it could be related. Here are a few different type of movements that could help the sciatica pain. For example, if you do pelvic tilts, that can reduce the stiffness in your lower back. Do a series of 3. You have to work up to it. You can't start maybe with 20 right away. Just start with a few. You can do gluteal activation because weak glutes are one of the biggest contributors to sciatica. Gentle hip mobility that helps both sciatica and hip RA pain. Just something small like 5 minutes a day can make a really big difference. So yes, people with RA commonly can get sciatica because you're allowed to have problems that other people have along with your rheumatoid arthritis, unfortunately. But also just make sure it's not your RA pretending to be sciatica. Knowing the difference can really help address that problem. And to be honest, it's your body. So seeing those trends is really going to be helpful, and you have to pay attention to them, because I have patients where it makes no sense and it sounds completely like sciatica pain, and yet when they're taking their RA medication, their DMARDs, their methotrexate, or their Tanacept, or whatever biologic, they feel better afterwards. So then you have to wonder, is it really referred pain from the hip that's the problem and not true sciatica? So sometimes you may be able to solve that mystery quicker than your rheumatologist, and it's your body. Our job is to guide you, but you also have a lot of information that you can give. And if you haven't watched my video yet on muscle pain and rheumatoid arthritis, it's right here, and it pairs perfectly with this one. I'm Dr. Neha with Plant Forward MD. I'll see you next time.